Hi, my name is Raul,
And I'm Lindsay.
and we were part of a diverse team of evaluators, pilot program leaders, community health workers, or CHWs, providers, and parents who are partnering on a cross-sector care coordination pilot in the Columbia River Gorge, which is a rural area in northern central Oregon. And so the pilot project is a strategic partnership between us at the Oregon Center for Children and Youth with Special Health Needs and local partners in the Columbia River Gorge to support CHWs in bridging and connecting health, educational, and social sectors to better serve Latino Shin. And so we partnered with local organizations here because there's a large community of Latino families here, and because it is a home to an innovative hub model of care coordination that relies on CHWs. So in the first year of the pilot, we sought to understand the landscape of the cross-sector care coordination, SHIN and CHW role in that work. And so we collected from a number of partners, including CHWs, families, and providers. We provided here a list for your reference on the bottom left side of the poster. And so as you can see on the figure on the center panel of our poster, after a year of collecting of information and gathering data, we identified four primary needs of Latino Shin and their families, including resource navigation, access to high quality interpretation, community collaboration, and advocacy and persistence. And so all four of these needs can be addressed by CHWs in the Columbia River Gorge region. And so CHWs can fill these gaps, which you can see in the purple box on the center panel, by supporting clients and connecting with and accessing services and resources, persistently advocating for clients' needs, especially for interpretation and translation, communicating with healthcare providers and clinics, and then collaborating with other CHWs through a CHW hub. And so Lindsay's going to take the next part of the poster for us.
So we know that CHWs can fill these roles and some do, but there are also gaps in supports for CHWs themselves, which we heard from CHWs and from other professionals as well. And these gaps inhibit their ability to meet the growing needs of Latino Shin in Central Oregon. In the pink box that's highlighted at the bottom of the center panel, we present opportunities to strengthen supports for CHWs to do cross-sector care coordination work, including continuing to build former partnerships and infrastructure, exploring ways to expand an innovative CHW care coordination hub model, building shared understanding of CHW's role in cross-sector care coordination, building CHW's capacity to work directly with Shin and children broadly, since CHWs in the Gorge region typically work with adults, and partnering with existing committees and councils to offer training and education to professionals, including CHWs. Moving to the right side of the panel of the poster, we mentioned earlier that this pilot project is a strategic partnership between a number of organizations to strengthen cross-sector care coordination for Latino Shin. And partnership showed up in our work in a number of different ways. I'll highlight just a couple that we've listed here. One of them is the creation of ongoing engagement and leadership opportunities for Latino parents, as well as professionals like CHWs. And also supporting the local Latino economy through food, childcare, and interpretation contracts that are coming directly from that community. Now, before closing out, Raul and I would like to mention that our team includes two parents who have and are currently raising children and youth with special health care needs, and professionals who have experience working with Shin. 3 of our team members identify as Latino and have expertise in understanding the intersection of immigration, language, and race. All of us value community-driven work, and we all strive to integrate anti-racist evaluation and systems thinking to advance health equity for Shin and their families. Raul and I would like to also acknowledge our deep appreciation for all of the participating partners, especially the Latino families and community health workers whose knowledge and expertise continue to guide the work that we're doing on this pilot project. And lastly, thanks to you all for listening. You can download our full report, which includes our citations, using the QR code at the bottom of the center panel of the poster. And if you have questions, you can contact Raul or me, Lindsay, or any of the other poster authors. And our contact information is in the AMCHP directory. Thanks so much.